Good morning.
Good morning.
Good morning.
Good morning, everybody.
Good morning.
Good morning.
Good morning. Welcome.
Morning.
Thank you.
Good morning.
Morning.
We'll give people a couple of more minutes to log in and then we'll start. All right, we'll go ahead and get started. My name is Wes Gibson. I'm one of the co-chairs of the communications work groups. And every month, the Health Equity Collective hosts a networking session about all the topics and services, well, the many topics that are covered in public health. And so it's great each month that we are able to get different experts in their fields to speak and enlighten us more on everything. Just so you all know, the meeting will be recorded and we'll have each presenter go. And then Almighty Networks will post any resources or other services discussed so that you can have that as reference later. But I know, William, you're on a tight schedule, so I'll go ahead and introduce you. So this month we'll be talking about environmental health and climate change. And first we have William Lyons, Senior Manager of Programs, Health Connected Legacy Community Health. He's a licensed clinical social worker and supervisor with over a decade of experience across fields, including case management, clinical mental health services, community organizing, financial coaching, and nonprofit management. In his current role, he primarily supports the professional development of student interns and AmeriCorps members as emerging healthcare professionals across disciplines. In addition, he's a therapist providing psychotherapy to youth aged 12 to 17 individually and groups. All right, William, I'll go ahead and turn it over to you.
Hi, good morning. So I am not alone this morning. So I have Carmen with our SEER program, and I also have Dr. Brett Perkinson. So I also want to give an opportunity for them to introduce themselves as well.
Hi, I guess I'll go first. My name is Brett Perkinson. I'm a physician in family medicine and occupational environmental medicine and on faculty at the University of Texas School of Public Health. And one of my areas of interest is disaster response and environmental justice on neighborhoods that are affected by flooding. So glad to be here today.
And hello, my name is Carmen Kvetsa. I work for the Coalition for Environment, Equity, and Resilience. This is a 28 nonprofits that works in the connections between pollution, place, and our impact on our health. So I'm currently leading the Climate Justice Campaign. That is an initiative that we partner with Dr. Perkinson and William Lyons. And this is regarding educating community about the connections between how climate change is impacting their health, and also presenting solutions like a 100 to Feet program that we're going to kind of discuss in a little bit. Thank you.
And I'm going to go ahead and share my screen with the PowerPoint. And so feel free to put questions in the chat or unmute yourself. The idea this morning is we want to highlight how SEER has used community voice in their work, but then also for those who may not be familiar with climate change, provide that foundational education so that your own respective organization might consider your capacity to be involved in this work, because there is a lot of work to do. Technology, there we go. So these are the learning objectives. So we really want to have people understand the human factors impacting climate change. We want to advise community members and providers about air quality. So we're actually splitting that up with Air Alliance this morning. So Air Alliance is going to focus on the air quality piece, and we're going to focus on the heat stress and resiliency. And then briefly, we'll go over the mental health impact of climate change, and then again, assist your organization.
Saturday night to Monday, so no.
Assist your organization determine readiness to join this advocacy work. And I will turn it over to Carmen.
Thank you, William. Can you go next? So like I said, this is an organization of 28 nonprofits working in the connections between pollution, place, and the public health. And we were born after Harvey. It took an event the size of Harvey for the nonprofits to come together and stop working in silos and connect and say, how best can we collaborate to really push all this work that it needs to be done and better serve the community. Next. So when I start bringing this conversation to the community, the first person that I spoke to, she told me, lady, I don't know anything about climate change, but let me tell you, we are dying of cancer. For her, climate change was kind of the polar bears. She thought I was a reporter. And so I started really asking questions, right? And I say, okay, tell me what's happening with your neighborhood. And she told me she had cancer. Her mother had died of cancer. The daughter had cancer. And once you start listening, you start finding connections. So how are you going to bring this conversation, right? The coronavirus had just hit. So community also was hurting, we're surviving. And here I come talking about, hey, by the way, do you know climate change is going to be the next threat to your community? So that's how I start talking to them about climate change. But, let me tell you, I know you think about polar bears, but do you know that this is how climate change show up in your neighborhood? Next. Then we have the Uri storm. And this is the first event here in Texas that we get affected across the board, right? There was no color differences. There was no zip code differences. But once again, the communities that they affected the most, it takes longer to recover. I work with some residents that they thought they will be dying frozen in their bed, right? And their homes are from the 1930s. So all of this was part of like, how do we connect with something that is meaningful to the community? Next. So the way that we move forward this work, it was recruiting residents to work with us as a climate ambassadors. We training about what exactly is climate change and how we're going to bring this conversation to residents that they trust. When I start going to the community, they didn't want to open the door for me. There's a lot of pain. There's a lot of mistrust in those areas that I work, which is the Northeast Corridor. So that was the way that I find to really start working with community, building the relationships through people who live there and who have the trust of the community. This is Sandra Edwards. She lives in a home that is not fully recovered. She got affected by Harvey. She got affected by Imelda, and she got affected by Uri. She also lived in the plume of the creosote contamination. She is the leader of the community, and she jumped into this climate change conversation to continue educating and telling community the connections, how everything is connected and how climate change is going to make things worse. Next. So, like I said, the way that we move forward the work, it was recruiting climate ambassadors. We trained them and we went into the community to educate residents about what exactly is climate change. What are we talking when we say climate change and how that's impacting you? So we did over 600 surveys at the time of the analysis. We have 572. And we broke down the surveys into what exactly is climate change, education portions, what are the consequences of climate change, and what are also solutions of climate change. Not only presenting all these threats, but it's like, these are the things that we can work together to help you weather the storm. Next. So community choose to work into their homes, to make their homes climate proof. However, out of the I think we present about 7-8 solutions. The number one that they want to work on, it was illegal dumping. That's one of the biggest problems in the community. And they want to work in things that they see. They saw, illegal dumping all over their streets, flooding their gutters and the trenches, and they want to work on that. It was a lot of education, because when we start doing the analysis, those were the beginning responses. Then later on, it start changing. And that's what we saw. There's like, we are being affected, educated, right? They start seeing the connections about the quality of air. The smells that they were breathing in the community was really connected to the cancer that they were having. And how, it will be better impacts on their health if they live in a house that it has good air conditioner, is fully insulated, and they also have a good filtration system. So the answers start changing towards the end of the survey. And then we pick this as a policy solution. We're going to be working with the city, with the climate action plan, but also working with our partner HARC, which is a research institution here, to put together a pilot to really see and show the city what do we mean by a home retrofit program. So this is what we've been focusing for the previous year and the next year. And that's the role of Dr. Perkinson and William, helping us come up with metrics of how we're going to measure the outcomes and the impact that this can have in our residents' health. Next. And the way we want to do this is in a holistic approach, not only mechanical, but also bringing energy efficiency to tackle the energy crisis. We are still struggling for residents to see the connections, right? That is not only going to have a house that is going to be climate proof, but what is going to be the impact of using less electricity. So that's the part that we still need to connect. And again, all this is going to come through education. The health portion, we are thinking in the filtration system, because that's one thing that is terrible in the houses and they're still from the 1930s. So asthma is a big component in the Northeast communities. Next. And this is how we do it. Really spending the time building community relationships. It took me about 2 years to really build those deep relationships that right now I can call them and they open the door. They invite me, they trust me. And so when you get that into the community, then the work is start moving forward. But unfortunately, a lot of time, organizations and research institutions, they don't take the time to build those relationships. And that's why things don't move forward in a way that is really meaningful for community. And I think that's my part that I have. And I think I'm going to hand it here to Dr. Perkinson.
The next part of the presentation is really just a brief summary of how we present the information to healthcare providers and members of the community. And so with my background in healthcare, we're really trying to emphasize why is it important for a healthcare provider to be an advocate for their patients in the area of climate change. And so we start off really just describing what is climate change and why are we concerned about it. And so I talk a little bit about the physics of it, of how the ultraviolet light comes from the sun. As it hits the earth, it changes the wavelength upon hitting the earth. And then that change in wavelength is absorbed by carbon dioxide, and that stays in the atmosphere for 100 to 1,000 years for a long time. And then talk a little bit about the melting polar ice caps and how that you lose that reflective surface. And so you're actually absorbing any more heat energy as time goes on. And then to talk a little bit about the length of time and how from any given decade, you'll see ups and downs in the temperature and causes to that. But the overall trend is definitely an increase. And if you even go back further in time, 800,000 years, when we're looking at ice cores that we're measuring, you can see that the CO2 levels are far above anything previous in the many ice ages and other different meteorological events that we've ever experienced before. Next slide. And then this wheel is really just kind of describing how in the middle here, you have the meteorological effects of what happens with climate change, and then how does that affect the weather and the ecosystem in the second sphere, and then lastly, in the outer square, how does that affect our health? And so all these different areas are impacted. And obviously heat-related illness is something we all know a lot about in Houston, but there's other more sort of indirect ones, an increase in pollens, the changing infectious disease vectors, really to give and to sort of speak the language of the healthcare providers. They know about all these issues and to say this is being impacted by climate change. Next slide. A little bit about also the effects that if you change, that we do have some, we're not helpless here in our levels of CO2, that if you can control the levels of carbon dioxide in the atmosphere, that there are some scenarios that the United Nations have come up with of what the temperature looks like in the next 50 years and the next 100 years. And you can see right now we're about, depending on where you are on the earth, between 1.6 and 2 degrees difference between pre-industrial levels. And you can see on some of these scales, by the late 21st century, will be as much as 8 degrees difference. And so with the impacts that we can see today in the natural systems, you can imagine what they're like at 8 degrees. Next slide. And then sort of try to hone in down on the local Harris County information. We've done there's a number of studies that have done heat mapping, pretty extensive heat mapping that can show the differences in the community. And you all that are affiliated with Harris County are probably familiar with some of these maps, but you can really see an association in that oftentimes the lower socioeconomic areas of Houston are the ones that are the hottest, and those individuals are least able to keep cool, to keep their home cool. They oftentimes don't have central air, and then they're also impacted by flooding. And as Carmen showed, in a lot of these neighborhoods, they are still trying to recover and trying to build back their homes 5 years after Harvey. Next slide. Also talk about, this is not some gradual process yet that we don't need to worry about until 2100, that there's acute events that occur, like the one that occurred last year in Seattle. Numerous ones occurred this summer, where you have this, it's called an omega block, where the jet stream comes up and around and then kind of keeps this central area. And last year it was Seattle. And then you have a lot of heat illnesses within just a week during one of these heat waves. And we had 800 deaths were attributed in the Northeast during that heat wave. You can see pictures of cooling centers that were set up and how the wildlife was affected. really try to get it into the providers that this is an event that's occurring now. Next slide. And then this is, again, sort of from a medical-centric kind of slide that shows in regards to heat-related illness that not only is it heat-related illness, but all these medical factors that you see make one more at risk. And so the medication, so you think of all the people with high blood pressure and the diuretics they're on, that affects your ability to tolerate heat because your volume is less for these diuretics. Pregnancy, age, you can kind of go through the list here. All these things are factors so that we really need to set up medical surveillance systems in our employee populations. I mentioned my background's in occupational medicine. Employers that have employees that work in manual outdoor jobs really need to set up medical surveillance because this is an unprecedented temperatures that we're experiencing. And as healthcare providers, they can have input into their patients' screen and recommendations and work accommodations in order to be properly prepared to work in these conditions. Next slide, please. This is just a heat index graph you may be familiar that takes into account both temperature and humidity that helps us get a better idea of one's risk for heat stress and in some of the information that's given that's available to providers to provide to their patients about developing heat stress programs. Next slide. These are just some of the symptoms. We kind of get into a review of the symptoms between the different levels, between heat rash, heat exhaustion, and heat stroke. All of these present differently. And we as providers need to be aware of these issues. And also the idea that if you have had a heat exhaustion or heat stroke, you are more at risk for future events. And that again needs to be relayed to patients that are coming in for some of these issues. Mm-hmm. Yes?
No, I'm sorry.
Okay, next slide. Yes, and so then we talk a little bit about flooding. Next slide. And so I like to try to make the providers aware of some of the resources. And so NOAA has a great resource that it can predict any given area of the country where there is a flooding event. And you can give 11, you'll see up there on those tabs, say for a hurricane, a category of hurricane, what will be the associated storm surge that's associated with that? And where will the affected areas? And so you can see that if a hurricane comes into Galveston Bay, you can see that in the areas immediately surrounding Galveston Bay, you need to be over 9 feet above the level of the bay in order to be protected from the storm surge. And so you can imagine for all of you who've been down 225 to look at the ship channel, how that would impact. We'd have one of the greatest environmental disasters that really that our country has seen if the right hurricane hit at the right spot and how vulnerable we are. And this is sort of the advocacy for building things like the Ike Dike that's recently been improved. That their plans are underway for this. Next slide. And then I'm going to turn the presentation over back to William to talk about the mental health.
There we go. Sorry about that. So a lot of what I've done as far as research, as far as climate change and mental health effects, is just realizing that there have been a lot of disasters in our recent history that have really shown a lot of data. And so this data that I'm highlighting is from actually Hurricane Katrina, and this recognizing that after Hurricane Katrina, that we recognize that 25 or 50% of people were exposed to that extreme disaster, and that really increased the risk of adverse mental health effects. Of the 49% of the survivors of Hurricane Katrina developed some type of anxiety or mood disorder. And 1 in 6 developed some type of PTSD and also experienced suicide ideation, which kind of more than doubled. And so we recognize this impacts both adults and children. And we recognize that, basically, a severe weather event can cause a mental health crisis. And so recognizing, as we already have acknowledged that our primary care facilities are overwhelmed with tasks. Many of us who work in behavioral health services know our resources are limited as tasks as well, given the other things that call for our attention in the behavioral health sense, given the mass shootings that we experience, given the already opioid epidemic and other addiction crises here in the United States. So risk recognizing that climate change potentially can impact our behavioral health services in these United States. Okay. And so these are some of the things that are conditions that, might help someone know if they're at risk. So recognizing that our community has sometimes pre-existing or known conditions. So someone who may not know that they are suffering from depression, may not know they have anxiety, may not think of their addiction as something that needs to be treated. Recognizing that our accessibility of behavioral health services, so how long is the wait list to get into therapy or to see the psychiatrist, recognizing that substance use usually increases after a natural disaster. So one thing I recognize even after Hurricane Harvey, some of the first stores to open were liquor stores. So just recognizing the accessibility of, substances available for people to use rather than, crisis intervention after a disaster. And recognizing that new adaptive behaviors develop, and some of those may be positive, some may be negative. And so recognizing that, people are going to do what is most accessible, and then also what other people might be doing as well. And so things that we know impact us are, stress, being distracted, having loss of faith or spirituality, insomnia, anger, fear. Those are some of the symptoms that come from these kind of disasters that are, human-made. And so a lot of what we are working towards as far as resiliency is this disaster preparedness. And so recognizing that our work here at SEER is helping organizations beyond ours, evaluate potential risk, educating as much community members, employees about it, building those professional relationships and those relationships with the community, trying to get resources for both primary care and mental health services, and also recognizing financial preparedness. So oftentimes at least I'm hearing a lot of conversation about, get flood insurance. And then I know even after Hurricane Harvey, many people who did have flood insurance said that it didn't pay out in the way they thought it was. So recognizing that someone might invest in something but not get that return on investment. So these are our take-home points. So recognizing that extreme heat really affects vulnerable populations, particularly those who work outdoors, people who the medications they might take might impact their ability to recognize heat stress. We know airlines will highlight the air quality piece. For mental health services, recognizing that people who are impacted by fluctuations in the weather, this is associated by climate change, and recognizing that our environment is ever changing based off the climate that's impacting us today. So there are some resources that we wanted to highlight. So Lone Star Legal Aid actually has a toolkit for disaster preparedness. And so really helping the community know about their preparedness materials. They also help with wills and power of attorneys, help with home repair contracts. So one thing that I've heard from some of the conversations 5 years after Harvey is people would, get a contractor to do the home repair, and then the contractor would do half the work. And so recognizing that, we need some type of support to kind of help people not be taken advantage of during this already vulnerable time. And here are our resources. And with that, I would turn it over to Air Alliance with Jen Hadafa.
Thank you all for that presentation. Jennifer, or do you need to also, are you able to share your screen? Okay, perfect. All right, well, Jen Hedaya is the Executive Director of Air Alliance Houston. She has worked for almost 25 years in public health and health equity with state and county health departments and nonprofit organizations in 5 states and the District of Columbia. Jen was born and raised in Houston and is a proud resident of Houston's near North Side, where she lives with her husband and a variety of rescue pets, including a 33-year-old box turtle.
Good morning, everyone. It's really a pleasure to be here today. Since this is a networking session, I actually thought that I would start my portion of the presentation with a story, which is actually my own air quality awareness story. And in some ways, it is actually my father's story. So you will see him on the left-hand side. This is the two of us in Big Bend Park. On the right-hand side, that's the two of us in one of my father's favorite places, which is in his back porch at our house where I grew up in near Hobby Airport. And then in the middle is my father and grandfather, who both worked their entire lives at the Port of Houston. My father was what's called a steamship clerk. He worked on the docks every day, standing in the sun, inventorying and offloading the big container ships, those big shipping containers that many of y'all have probably seen. And there are two things I remember growing up my father never left the house without. One of them, his cowboy boots, which he's wearing in this picture. And the second was his asthma inhaler. My father had often debilitating asthma his entire life, as well as a host of other health problems. And he died very young at the age of 39. It would be well over a decade after his death, after I had been working in public health, before I started making the connections between where my father worked every day and what he was exposed to every day in his work and his debilitating asthma and other health conditions. And I remember to this day where I was when I learned it. I, for the first time, read the report from IHME, which talks about global burden of disease. And I saw in the top 10 air pollution, and in particular, particulate matter. And it reminded me also of a memory of my father where he would come home from work, covered head to toe from the port in dust and soot and exhaust and grime and who knows what else. But very likely particulate matter had been inhaled from him all day long, or by him all day long. And that particulate matter lodges in our lungs, it exacerbates asthma and other respiratory conditions, and it causes heart attacks. So I remember when I made that connection, I was actually sitting in an office right next to Albert Chang, who was on this call at Harris County Public Health when I read that report. And it was a few years after that, that I was also making the connection that exposure to environmental harms was not accidental. It didn't happen just by chance, but in fact, those exposures happened deliberately through policies and decisions, and they tended to impact Black, Brown, Indigenous, and lower income people more than others. And as they say, mind blown emoji. And so in my personal opinion, that was the beginning of my air quality journey and why I believe that air quality is one of the most impactful upstream causes of virtually every downstream health outcome, including more that we are learning about in research every day. Just last week, The Guardian reported on new research that connected car exhaust to lung cancer. So I am humbled and proud now to be able to be doing the work that I'm doing at Air Alliance Houston in honor of and for families just like mine, because my aunts and uncles and cousins all still work the ship channel, all still work in the refineries, and they are breathing in air pollution every day. So for those of you who like a little data sprinkled into your storytelling, I present to you a map that is probably very familiar to most everyone on this call. This is an iteration of the Houston Arrow, and it's the difference in life expectancy across Houston. You can see what some of those differences are. And of course, the lower life expectancy tends to align with race, ethnicity, and income, as well as deliberate patterns of disenfranchisement. I give you the second version of the Houston Arrow that shows up blindingly bright, right? This is the environmental justice screen for the Houston-Harris County area developed through the EPA, and it maps similar indicators of social vulnerability, life expectancy, downstream health outcome, risk for health concerns, but it overlays it with environmental risk. And those places that have the darker blue are places with greater environmental harm. And there's no mistaking where those same places are in our community. They are still in places primarily where Black, Brown, Indigenous, and lower income people live. So our mission at Air Alliance Houston is twofold. It combines both of those things. Our mission is to reduce the public health impacts from air pollution and advance environmental justice through applied and community-centered research, education, and advocacy. We believe everyone has a right to breathe clean air, and this is not an uncommon phrase for everyone on this call, that where you live in the Houston area, Harris County area should not determine your health. To accomplish this mission, we run 5 different campaigns. We have a proliferation of air pollution sources in the Houston Harris County area because of our petrochemical industry. So we have a robust industrial emissions opposition program, and I'll show you an example of a little bit of that in a moment. On-road emissions is one of the leading causes of air pollution in Houston. In fact, 50% of heat trapping gases that cause climate change come from on-road sources, cars, trucks, ships, trains. And so we also have a mobile emissions reduction campaign as well. Heard a lot from the previous speakers around disaster prevention. We also have a chemical disaster prevention initiative, keeping in mind some very recent events that we heard from our other speakers, but one that is going to be pertinent, and I'll talk a little bit about later. That's the ITC Deer Park explosion, which burned across Houston, or fire, which burned across Houston for 5 days in 2019, spewing tons of volatile air pollutants into the air. We also run a community air monitoring program in environmental justice communities because we believe that people can be equipped with information about their air quality to protect their health and take action on behalf of their community. And underpinning all of this work is our Mobilizing Action campaign, in which we work with residents, policymakers, civic leaders, partners, other groups to raise their voice and make their voices known and help us advocate and make change in air quality. We believe that every environmental decision is an opportunity for community voice, from a single permit for a concrete batch plant in a residence all the way up to the bipartisan infrastructure law and the Inflation Reduction Act. Every decision is an opportunity for community voice. We also believe that those who have been harmed by air pollution have the right to influence the decisions made about air pollution. Nothing about us without us, as the phrase goes. And the lack of transparency in the current environmental decision-making process is an intentional policy decision to disenfranchise communities. It is not accidental or unintentional. And again, why I personally believe that air quality is one of the most important, not only public health issues, but health equity issues that we have facing us today, and especially in the Houston area. I do want to pause for just a moment, Wes, and ask you about my time. I can't see the time, so do you need me to start wrapping up, or do I have a few more minutes?
You're good. It's 9:06. Keep on presenting.
Great. Okay. So my last section is I want to give you a few examples of how Air Alliance raises community voice and engages community voice. I hope this will work. This is supposed to be a live link. Let's see what happens. Hold on. Did it go? Yes. Okay. Can y'all see this new screen? All right. So this is, I am thrilled to share this with y'all because we literally cut the virtual ribbon on this tool on Tuesday. This is called Airmail. This is a system that automatically scrubs all air pollution, water pollution, municipal waste pollution permits that by law have to be approved by the Texas Commission on Environmental Quality, scrubs them all in real time every day and puts them in a place where people living in those communities at fifth site or impact zone can see them and can act on them. So this is just our community here. This will give you a sense of all the active permits. Actually, the blue dots are active. The gray dots are permits that have had comment periods passed. Every permit, if you're not aware, has a comment period where people can raise their voice and respond to the permit. But as I said before, that system is by design convoluted, difficult to access, and most people don't realize that they have the right to raise concerns or even know how to do so. So Airmail was
I'm sorry to interrupt, but we can't see the screen that you're referring to. We're still looking at your slide.
So my live link did not work. Okay, hold on. Let me start over. My live link didn't work. It was too good to be true. Okay, can you see it?
Now I can see it.
Okay, the live link didn't work. That's okay. We will navigate in a different way. So a quick step back. This is Houston Harris County. All the dots here are active air, water, or municipal waste permits. Blue meaning the comment period is still open, gray meaning the comment period has passed. So the intent of airmail is to scrub permits. I mean, there are permits that come out every single day. There's hundreds of these happening all the time, just in our community alone. Put them in a place where people can access them and connect people to information about how to act on them. So I want to pick one that's of concern. I said I would mention this before, and I probably just need to find it. Hold on. Let's do Deer Park. Here we go. So I mentioned earlier about the ITC Deer Park terminal that set itself on fire in 2019. They have a federal operating permit that's come up for renewal right now. And so airmail allows for people to get access to information about that permit and do some really important things with it. They can go directly to submit their public comment about the permit, and they can contact their legislators about the permit. What we have the ability to also do through airmail is, with literally the click of a button, we can notify residents at any one of these 1, 2, or 3 mile radiuses, fence line or impact zone, that this permit is up for community voice. And in that notification, it's a very low-tech postcard. It looks like this, English and Spanish, with QR codes and information, and the same information about elected officials, so people know that they can raise their voice about this permit. We have so far used this system to send out 10,000 postcards to notify people that this is happening in their community. So this is a brand new system that we have for bringing information in an accessible and navigable way to people to know that they can raise their voice against pollution sources in their community. It covers refineries, terminals, concrete batch plants, metal recyclers, any one of those pollution sources. So not just the big ones, not just the Chevrons and Exxon Mobils, but also the concrete plants in our community. And they're all here for people to get access to how to respond. But with that said, and I'm going to probably have to move around a little bit to get to my next page, because I don't think you'll be able to just follow. So let me stop share and reshare. With that said, even when community members have information about a permit that they may want to respond to, that it can't be assumed that they have articulated their story or articulated their concerns before. So we also have launched what we call our Environmental Justice Leadership Lab. And the Leadership Lab is a hub. This is the virtual version. There's also an in-person version. We have, human people who talk to residents as well, that give people access to what does a comment letter look like? How would you tell your story in public testimony? What does the process itself look like? Just simply trying to demystify this environmental decision-making process that governs our entire state, so that there is a place for communities' voices to be. And so this is the virtual version. We also work in person with staff. We give legal advice. We help them write comments. We help them submit comments, because that's a whole challenging process too. And we engage with our elected officials to do all of the above. I think I'm going to have to stop share and share again. The next program I wanted to share with everybody is our community air monitoring program, because this is another opportunity for community to become advocates for their air quality in their community. We have a network of about 30 plus relatively low cost air sensors that we place in people's, there we go, there's a little bit of a map there, that we place on homes, on churches, on municipal buildings, on community centers, and in real time monitors the air at a neighborhood level. And those folks who host our monitors, we also work with as air quality ambassadors. They talk to their neighbors, they go to PTA meetings, they go to super neighborhood meetings, and they give presentations about the quality of their air and the use of their monitor data that's in their neighborhood. We are at a point with our monitor network now that we have about 6 months worth of trend data at this neighborhood level. And we are now holding meetings. One of them is next week in my neighborhood of near Northside, to present trend data and work with community to adopt action plans to identify how they want to act on those data. So a true data to action initiative. Is there a recycler in the community they want to work with to become a better neighbor? Is there a permit they want to mobilize around and oppose because it's affecting the air quality? Do they want better transportation planning that reduces car dependency, and how do they mobilize to do that work? We will be holding those community data to action planning meetings in every one of our EJ communities between now and the end of the year. The last one I wanted to talk about as an opportunity for community voice, and I don't think this really needs a slide, and it's our work to ensure that we as an organization are informed directly by community voices as well. We have a group called the Air Quality Advocates Committee. These are people from all backgrounds and all professions, and people who are simply concerned residents who advise us as an organization on the campaigns I've shown you, on airmail, on even the design of our website, which we actually just redid. It's an area that I think I probably speak for many of us when I say is one that needs some more robust attention. I think the global coronavirus pandemic was challenging for us to keep our advocates committee engaged, and it's a priority for me as the ED going forward this year to make that input more robust, so we are truly community informed in the work we're doing, in my work as the ED, in our strategic plan, and in our campaigns going forward. So I realize I went very fast. I was just trying to be mindful of time and leave some time for everyone to ask all their questions at the end. So thank you again for this opportunity. And I am thrilled that Health Equity Collective is looking at upstream factors of environmental harm and environmental justice, because again, in my opinion, they do truly impact our entire community and they are driven by health equity concerns. So thank you for having us today.
Thank you, Jen. And also, if you don't mind sharing all those links you presented, please do, and we can put that up on the resources page. Well, yeah, I guess I'd like to open up the floor. Did anyone have any questions or points that stuck out to them?
I guess I might open up for initial question. Really, really nice to see. I was on the board in the past of Air Alliance, and it's been a while since I've circled back. So really nice to see you guys have made a lot of forward movement. One of the issues in working with SEER that I've seen is the gap in technology about many of the neighborhoods, the people in them that are most effective aren't able to access the internet or do it very easily. And I wonder if some of these new tools that you have, if you all have thought about how do I access or get input from individuals that might not be tech savvy to have an internet site and or utilize volunteers to tap into those individuals.
I think that's a great question. And certainly what I showed y'all today are the online options since we're in a Zoom environment. And you know, some of the other examples of engagement in at fence line level and one-on-one, you know, we lots of photos that we could show you of the work that we do. But what we try to do is have a pairing. So if there's a tool that's digitally dependent, there is a pair of a tool that is not. So airmail is digitally dependent, but postcards go to people's homes in their mailboxes, and they are not digitally dependent. There are phone numbers on here where people can call, if you know, email addresses, if that works too. Our community air monitoring network really doesn't have a digital tool except a dashboard where people can see the data, but all of that work happens in community between our staff and concerned residents to install and maintain their monitors. We do show them how they can check real time if they have it on their phone or some other mechanism where they can look at the AQI. But we also return that information back to them, which is why we're going back and having meetings and why we present in a number of community meetings to make sure that people who may not have access to those things still do hear from us and still do see the data that we're presenting. Our EJ Lab, same thing. I showed you the virtual hub. We run a monthly event called Coffee and Change, which is in a coffee shop in an EJ community where we go and we sit and provide information, education, legal advice, what have you, and we provide coffee. We also pair of two other things, which I think is important to reference. We have a commitment not only to environmental justice, but also to language justice. So to the extent possible, we pair all of those things in English and in Spanish. So I mentioned that we cut the virtual ribbon on airmail earlier this week. We had an English language webinar. We're having a Spanish language webinar in a couple of weeks as well. So to the extent that we can, providing all of that information, our materials are bilingual. We ensure that there's bilingual interpretation at all of our community events to ensure that people have greater access to that work.
Thank you.
This was phenomenal. Thank you, Jen. Thank you to all the speakers. Question for you all. Part of the work of the Health Equity Collective is we're looking to support advocacy efforts. Are there particular priorities as we look forward to the next legislative session?
I didn't even plant this question with you, Heidi, but I'm going to put in the chat. We are building our legislative agenda as we speak. I have a survey I would love people to take so you can give us direction on what you think Air Alliance's legislative priorities should be. I'm going to find it and I'm going to put it in the chat. Thank you, Heidi.
Wonderful.
Didn't get a chance to mention that, didn't even plant the question, but yes, we are preparing a legislative agenda now, but we're preparing it based on input that we receive from our community. And this survey is about prioritization. So it's a survey asking people, what should our priorities be for the 2023 state general legislative session that begins in January? I'm going to grab it and put it in the chat.
Wonderful, wonderful. So our policy work group has started a Google Drive folder to share agendas so we can support each other in the upcoming session. So those will be links we'll share out later as well. So love to gather those from y'all. I'll be quiet now and let everybody else ask questions.
And I guess I would just add from our organization, Sear and Carmen or William, if y'all want to chip in, but one of the things that we realize is so much of our neighborhood's ability to bounce back is to get access to funds to remediate their homes, and those have been tied up. And so if there is legislation that can help that process of the HUD funding for flood victims that goes to the GLO, that goes to the city, that then goes to residents, that's sort of what we've been trying to unravel. And how can we expedite that? Are there other funding sources? Is there a faster way that we can get funds to where people that need it? So that when we don't have these large populations that 5 years after the flood still can't really access the funds that they need.
Yeah, if I cannot just add to what Dr. Perkinson said, we are working on a disaster shelter. I put that on the chat. This is a community center that is right there in Fifth Ward. In the Northeast, there's no disaster shelters. Residents are kind of left on their own. So a couple of our groups, they're working on disaster hubs, but this one will be a main center.
Jaime or Jamie, I see that you have your hand raised.
Good morning, everybody. It is Jaime. Thank you. Jessica, so first of all, just fantastic presentations and work, and thank you for everything that you guys are doing. There's a lot of evidence, as you know, around tree canopy cover, urban heat, air quality, all that stuff. Many of us are working with the mayor's office to see what can be done around equitable tree canopy cover. Have you guys been engaged in conversations with the city or other people about getting more trees into communities for their protective values?
Is that a question for all of us or
anybody and everybody?
Well, I feel like I've been answering a lot of questions. So William or Carmen or Dr. Perkinson, do y'all want to chime in first?
Carmen, have you worked with anyone? I guess I'll punt that to you, the question to you.
I'm sorry, I just got something in my throat. But yes, we connect with Trees for Houston. But unfortunately, last year, due to capacity, we were not able to do that. There's going to be an event, and William is going to be presenting or being part of this event this Saturday, educating community about the potential of putting more trees and plants, and then it's going to be a giveaway in November. So that's the connection right now that is happening in the Fifth Ward. Hopefully, William came back and can put a flyer there.
Thank you, Carmen. Air Alliance is part of that event too. And I will tell you the plant giveaways, we've been adding plants to all of our health fair tables and people just love getting plants. I mean, I do too. Don't we all love plants? The only thing I would add, Jaime, is that as part of primarily our mobile emissions reduction campaign, we have a climate justice campaign. And as part, this is a very nested answer, I will get there. Within our climate justice campaign, we're conducting assessment and developing planning now around the environmental justice perspective around decarbonization. And decarbonization has two general forms, right? You can decarb through technological solutions, or you can decarb through organic solutions. And so we maintain that, frankly, organic solutions are preferable because they come with collateral benefit like more trees and more shade. We have a very, I would say, powerful influence currently at a local and federal level to push the technological solutions. So our connection right now, I think, directly to issues around tree canopy and organic solutions to decarb is in context of our climate justice work. And I hope that by the end of the year, we'll be able to present some of our results on the assessment that we're doing of EJ communities and their perspectives, not only on organic solutions, but also on the technological solutions, so that we can advocate to those who are really pushing carbon capture, storage, utilization solutions on us without hearing from community about what they need.
And I was just going to add, Jaime, one of my colleagues, Kevin Lanza, who I put in the chat box, is one of our faculty that specializes in heat mapping and trying to reduce heat islands. If you are looking for any kind of academic partner in what you're working with, he's primarily in Austin, but he does work in Houston as well.
Dr. Perkison, on those maps, are they mapping like the percentage of concrete and asphalt with the percentage of trees in association with the heat?
To my knowledge, that resource that I showed on the screen, it was actually done by a volunteer organization, and it was atmospheric. It wasn't ground temperature. It was air temperatures. But to my knowledge, it did not take into account the tree cover. It was simply the temperature measurement.
Thank you.
Well, thank you, everyone, for presenting today. That was very informative. A lot of great information. Just please, if you, I know William, you sent me the slides, so I'll be sure to post those. But yeah, Jen, if you could also send that information, we'll put that up. And of course, we have the recording of the session today as well. And yeah, thank you, everyone, again for attending, and hope you have a good Thursday.
Thank you.
Thank you all.
You.
Bye-bye.